Some $300 million will be utilized to purchase oxygen for COVID-19 patients at the Infectious Diseases Hospital, Liliendal. Minister of Health Dr. Frank Anthony said during Thursday's COVID-19 update.
We have been paying approximately $1 Guyana per liter of oxygen. And right now, our patients, when they're in the ICU, some of them require about 15 liters per minute. So you can do the math and you'll see how much that is costing us. In some instances, we need to give patients as much as 30 liters per minute. So on a daily basis, we're spending a lot of money. And some of these patients in the ICU would be there for a minimum of 10 to 15 days.
In addition to the oxygen, money will be used to boost the capacity of the National Reference Lab.
We are spending 1.3 on consumables for the National Reference Lab. And basically, this is providing for the reagents and all the other pipettes and all the other things that are necessary for us to do PCR testing at the National Reference Lab. It looks like a lot of money, but consider that a PCR test is approximately $16,000 in the private sector. So this would allow us to do probably about 400,000 PCR tests.
Monies will also be spent to procure personal protective equipment for health workers.